And so what we've tried to do in our approaches, which we'll talk you through, is to kind of look at, rather than roles and number of roles, we've tried to look at skills and competencies on top of licence working to try to understand how we can map what the patient needs are locally to what can be delivered in different ways within your workforce. And this has meant that we've been able to create more creative solutions and opportunities for us to meet the patient needs locally and move beyond traditional role-based workforce planning to a very skill and competency and patient-focused workforce planning.
There's a good quote, 70% of organisational change fails. And quite often that's because we don't think about people. We think about it as an objective process. So the real important part is using data, insights and expertise to think about actually what is the problem here? What is it that we're trying to solve? And quite often people go straight to the solution without thinking about, am I making an evidence-based approach? How we do things. So what we've been doing in our approach is taking a skills-based approach. We're thinking about the content. It's the what and the who. And we start with the priorities. What are the priorities that you're trying to address? What skills will people need? And then what roles might be able to deliver that? And are you thinking that there might be some alternative solutions? But also mindset is a really important part of it. And actually the mindset that your leaders have can influence how successful your workforce planning is. Done a piece of work in primary care. We were commissioned by an ICS to support their PCNs with workforce planning. So the workforce team collaborated with our primary care team to think about, okay, how can we do this differently? So as we said, we got some data and insights here. So the more objective stuff, we looked at kind of population health data. We looked at national performance indicators. So for primary care, which is the example we're looking at here, we looked at the QOF, the DES, the IIF, and we looked at, okay, so what are their needs based on that? What are the priorities? We looked at their performance data and we also looked at their workforce data. So things like retirement risk. What will they need to plan for in advance? And you can see that there's only one that actually says workforce planning. The rest were around kind of elements that they needed to consider. But what was most key was thinking about where they were in their PCN development and leadership journey, because that would influence how effective and how successful their approach to workforce planning and strategy. From this presentation, think big picture. What are the factors that are going to influence your workforce moving forward? Those environmental factors. Find the best available evidence and data for making workforce decisions, and do take a skills-based approach to meeting population health needs.